Hi everybody, thanks for having me here today. I'm happy to be here. When I was asked to speak on this panel as an OPSEU representative, I thought, well, I'm going to talk to the workers of OPSEU to see what they know and who has sit-stand desks, etc. Like Jack says, I'm not an ergonomist. I came from the OPSEU membership. I started as a correctional officer back when I was 20. And there, if someone had said, what's a sit-stand work desk, I would have not known what it was. I mean, we had decrepit furniture. I think it's a little better now, probably, but what I did was, because I'm a health and safety officer at the union, and OPSEU, the Ontario Public Service Employees Union, represents about 130,000 workers across Ontario. In the Ontario Public Service, that's the OPS, the broader public service, which is the BPS, College Academic and Technology, which is CAT, Academic and Support, all the college support staff across the province. BPS includes pretty well everything you can think of, from ambulance and ambulance dispatch, fire, helicopter firefighters, all the government ministries in the OPS, retail operations, you name it, every job on the planet. So I thought, I've been collecting a health and safety email list kind of informally over the last 10 or 12 years that I've been there. I have about 400 OPSEU members on it that are health and safety geeks like me, right? So I'll email them out, things like this conference actually, and I met someone from the OPSEU membership today here who got the notice that way. So I also thought, well, let me ask my health and safety geeks about sit-stand work desks. So I said, hi, contact list, wondering if anyone out there has sit-stand desks and equipment implemented in the workplace. Does anybody have one? Do you like it? How did you get it? Does it work for you, etc.? And has anybody's Joint Health and Safety Committee discussed the health impacts of sitting and developed any solutions? And I said any info you can provide would be helpful. So I'm just going to, in my few minutes, talk to you a bit about who has them and how do they get them. I'm going to give you a few quotes, and then I'm just going to talk quickly about themes that I saw in that snapshot. So first of all, I got replies from a lot of the types of workplaces I described that OPSEU represents. You know, ambulance dispatches, paramedics, government, healthcare, colleges and the education system, the retail operation. So I said, how did you get them? And well, people said stuff like, well, I had back surgery and I returned to work and I got one. A new lawyer came to work in our office and they brought a desk with them and it's very nice and now we all want one. I heard of a worker who bought one herself and brought it to her own desk and bought her own desk and brought it to work. Someone said, I believe the employer moved to these desks on their own. A lot of people, I have lots of ticks beside this one, said they got it from an individual accommodation request. Someone said we got it upon request and there was an ergonomic assessment by the health and safety employer's regional rep and we got it, no questions asked. Someone said there's lots of paperwork back and forth and where there was a third-party ergo assessment, it was a really long process after a doctor's note and I got one. Another person said, I told my boss about pain I was developing and our rep came somehow and someone looked at my desk and I had one. Other people say I had a WSIB claim for a neck injury from bending too much, so they ended up getting a sit-stand stool. And I've heard this theme this morning from people, and the members that were emailing me said when we were doing renos, we put a couple in. So a time to change in the workplace seems to be a good time to do stuff. So I'll just give you like 5 quick quotes to give you a flavor. So, it's an absolute lifesaver, definitely provides preventative measures to help with back issues. Everyone should have one. Oh, my coworker loves it and a lot of people in the office now want one, myself included. 3, I tend to stand in the AM and sit in the PM. So now, a couple of more interesting quotes. I don't like the idea that I have to develop back problems in order to get one worker said. And then someone else said, probably tongue-in-cheek, yes, I do know someone in the workplace with a sit-stand workstation. I just saw it the other day. The person is in HR. So I thought, okay, well that's... So then when I decided to think about what are the themes, and also I am the provincial liaison to a few health and safety committees province-wide that our union has, like in the government ministries we have a few health and safety committees, and from the talks there. So the themes seem to be, well, let's do sit-stand specifically first. So some of the comments I got is, it takes a lot of effort to raise and lower them. So sometimes they find it hard to do that. One group at a provincial committee where the employer has implemented some adjustable stations, they needed an Allen key or something to adjust it, and they couldn't figure out where that was kept, where they're going to keep it, how people are going to get it. But then the big issue was that when they changed over shifts, because these were shift working jobs, that they weren't being allotted the time to fit the workstation before each person did that desk, because the work starts immediately. And then when I asked my members, well, just take the time, like, we'll decide where to keep the Allen key so that everybody can get it, but then, if the shift changes 3-4 times a day and the lineup is there, the workers didn't feel like they would choose to serve customers with the wrong sized sit desk rather than take the 20 minutes, grab the Allen key, figure out what adjustment they need for them. So, and also, a lot of people are in small cubicles. So the people in small cubicles and small workspaces, a lot of leased space and stuff like that, had a hard time that even if we could put it, we couldn't put it here. Sometimes there's cubicles running up and down a large auditorium-like building, and then if one person, and this was mentioned earlier also, stands up, then they're kind of looking over everybody else. And then there's also the other issue that, well, there's lots of employers who might do it preventively, but then what do they do? Get one for everyone, so where does it stop, and how do you do that? So that was, and then also people were telling me that they had one and that worked for over 10 years, they had no more pain, but then they left the job and they left the desk. So the issue is moving around. There's a lot of transition around the workplace, in and out, and stuff. So that was the comments on sit-stand specifically, but then I want to talk a bit about themes, because part of my trouble was when I thought of this panel is I thought, well, gee, I get thousands of calls for health and safety from workers, and I don't think anyone has phoned me specifically about a sit-stand desk, and you start to think about that. But what came through in my members' comments and what I see when I help them at their committees and everything is really sit-stand work desks are also a lot about, and we heard this today, how much does my employer really care about me and my health and safety? And their overall approach to occupational health and safety in the workplace. Now, I don't think the workers are thinking that an employer has to buy everyone a sit-stand desk in order to have commitment to health and safety, but the person especially who who came from this organization with 2,000 employees and saw one sit-stand desk in HR, that's where you start to get this idea that who has them and how do they get them, and how does the employer show the other workers that they care? Because, one of the other things is who do you pick, where to focus, and how? Is it proactive, is it reactive? Are employers responsive to my needs as an employee? Do they care about my pain? Because we've heard this today and my workers experience it too. Going to the doctor to get a diagnosis is what opens the door to accommodation and the assessment, and then at some point down the road, perhaps a sit-stand desk. So it's a long road and a big gateway and a lot of stuff for a worker to go to when they have pain. That's in the reactive mode. And then how do you make that jump to doing it preventatively, and where? So it's a lot of paperwork to prove a diagnosis, to get accommodation, to get it, all sometimes with some employers thinking, well, then how do I close the the gates after this. Like, how do I manage this? The other thing is it's just a plain old, there's a variety of jobs and a variety of work that sit-stand desks alone cannot address. So the issue is one of my retail operations actually had some sit-stand desks in the administration area. But in the rest of that workplace, workers were lifting 50-pound cases. And so then they look at the administrative area that's all outfitted with sit-stand desks, and they say, well, what about us? And what about me? I'm still lifting 50 pounds. So the thing is, how do you manage it when it's, you have to deal with what people perceive too. So if everyone in the administration has a desk and that they're still doing X number of cases per minute, 50 pounds down on the floors, there becomes this feeling that the employer doesn't care about them. And so in that way, instituting what's really a nice initiative to have the sit-stand desks in the front office turns out to actually be worse for the workplace as a whole, as all the other workers walk past, see it, and don't have anything like that, or anything their equivalent, you know, attention to ergonomics and loads and push and pull, pushing like blue carts over tape and rough pavement where they, you know, cases fall off on their feet, and, you know, they're thinking, what about us? You know, what about us? Someone said, sit-stand desks, I just want hours. So there's a lot of other issues at work. You know, the 8-hour day doesn't exist anymore in retail, and there's a lot of precarious jobs where people can't get more than a 4-hour shift. There's double the amount of casuals, as they can be called, or fixed term or whatever, double, triple the amount of people to shorten the shifts so that you know, they don't have to implement sit-stand desks because they have so many workers to spread the work around. So it's when I email out asking if they have sit-stands and they send me, I just want hours, I just want to, you know, have one job to make a living. There's other issues that come first for workers when you ask something like that. Now moving forward, I guess, you know, I mean, we've heard a lot today about, you know, what is the actual thing that we want? Is sitting bad for you? Is just standing less something we need to do in those kinds of workplaces? But I just wanted to tell you that it goes a long way for employers to do things preventatively. So, I mean, we all understand here, you know, that there are rules for accommodation and all of that type of thing that come under the Human Rights Code, you know, because that's an obligation, a statutory obligation for employers. So workers, you know, when they get hurt, they'll get a diagnosis and come in and go through that process. But doing this is so much more than that. I mean, I would say, as an occupational health and safety person, that the general duty to provide a safe and healthy workplace that employers have in Ontario for workers in Ontario would incorporate, you know, reasonably making all of the workstations, whether it's at a desk or in the warehouse, as safe as possible, and using, you know, information and research like this to inform those decisions. So that I would say that, you know, labor and workers in general have been trying to get more proactive preventative action in this area and others for a long time. And just to tell you, for 17 years, Repetitive Strain Injury Day has been held on the last day of February for 17 years now, where workers call attention to the hazard to the health that musculoskeletal injuries are. We've made repeated trips to Queen's Park and, you know, trying to get more onus to do things preventatively. The other thing is, since 1983, injured workers have been demonstrating at Queen's Park, you know, talking about the impacts of injury and how really what we want is injury prevention. So I guess when we take all this together and we think about, you know, this whole thing, this new realm that's coming, psychological safety is really part of this. And I was happy to hear some of the speakers in the morning talking about you have to deal with the full aspect of this, and I would ditto that 100%. I mean, some of my workers, and I'll give you another example, with a really great employer, but a small employer who can't afford stuff, the workers get stuff that another office in the building throws out. So, I mean, we don't want that worker to sit there and wait for one day when the office in the building that's not their leased area throws out a sit-stand desk, I bet that'll be gone really, really quick. But the message is, we have to do it preventatively, in response, like retroactively. That's the law for the Human Rights Code. We need to do more preventatively. And so if employers are responsive and taking care of what their workers need, and we've seen a few case studies and examples of it today, then at least we're on the right track. That's what I have. Thanks.